Good afternoon, everyone, and welcome to the full Cabinet meeting. I'm Councillor Susie Horton. I'm the Deputy Leader of the City Council, and I'll be chairing this meeting today. Please be assured that we've put appropriate cleansing and social distancing measures in place to ensure that this meeting is undertaken in a COVID-secure manner. Public seating has been made available. Can I please ask members and officers to remain seated throughout the duration of the meeting? Unless you've done your bit, in which case we'll allow you to leave. A bit of housekeeping, no planned fire alarms, so if it does sound, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts and assemble near Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust's fire marshal regulations, anyone who signed in at reception should sign out when leaving the building, please. Everyone speaking via microphone will be recorded and broadcast on the website, including any deputations, which I don't think we have. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not want to be recorded. And please can everyone use the microphones and remember to switch them off when they have finished speaking. We've all read the reports, so officers, please just highlight any developments that have occurred since publication. You may highlight the key points for clarity. Okay, so now we're going to do some introductions. I'm going to start to my left, and then we'll do the first row and then back.
David Williams, Chief Executive.
Chris Ward, Director of Finance.
Anna Martin, Democratic Services.
Helen Dickerson, Deputy Monitoring Officer.
Chris Atwell, Cabinet Member for Communities and Central Services.
Councillor Steve Pitt, Cabinet Member for Culture, Leisure, Economic Development.
Matthew Willington, Cabinet Member for Health, Wellbeing and Social Care.
Councillor Jason Zackley, Cabinet Member for Communities, Safety in the Community, sorry.
Yeah, I'm Councillor Lee Hunt and I'm the Cabinet Member for Planning Policy and City Development, but I also help look after with Jason Nelson Ward, which covers Stamshaw, Tipner, Buckland and North End.
And Mile End.
I'm Darren Sanders, I'm the Cabinet Member for Housing and Preventing Homelessness.
Lynn Stagg, Cabinet Member for Traffic and Transportation.
Kimberly Barrett, Cabinet Member for Climate Change and the Environment.
James Hill, Director of Housing, Neighbourhood and Building Services.
Sylvia Macy, I work for Hampshire and Isle of Wight ICB, which is the NHS, I'm sure you know.
Steve McInnes, Acting Deputy Director of Primary Care for the Hampshire and Isle of Wight Integrated Care Board.
Phil Bentley, Head of Estate Services.
Adrian Rosier, Service Manager for Parks and Open Spaces.
Ian Maguire, Assistant Director for Planning and Economic Growth.
Tristan Samuels, Director of Regeneration.
Welcome everyone to the meeting, and also I realise that I meant to send a state apologies. So Councillor Gerald Lennon-Jackson is not here today, and also Jo York has sent her apologies. She's the Managing Director of Housing Care Portsmouth, and Steve McInnes is going to cover that item. So the next item is anyone who has any declaration of interest in any of the items on the agenda.
Yeah, I should declare that I am a board member of the Integrated Care Board, the ICB.
Thank you. Can't see anyone else. Okay, so item 3 is a record of the previous decision meeting, which was on the 21st of June. For those people who are here, do we think that it is an accurate record of that meeting? Yeah, agreed. Thank you very much. So, on to the item 4, which is a GP provision in Portsmouth. So I will hand over to Steve to highlight the main points of this report. Thank you, Steve.
Thank you very much, Chair. And thank you for receiving this report on GP provision in Portsmouth. just like to highlight a few key points, if I may, and then I'll open up to any questions. I think, first of all, I would just like to take the opportunity to place on record my thanks and acknowledgement to all the GPs in Portsmouth for all the work they've done on the COVID vaccination programme and beyond, and I would extend that to the nurses, healthcare assistants and the various other clinical roles as well, and of course not forgetting the non-clinical teams, including receptionists as well. I think it's been really important work they've done over the last couple of years in particular. In terms of GP provision, there was a recent publication, which I know is in the reports, that highlighted Portsmouth had the lowest number of GPs in England. There was a fairly big caveat that you could apply to that because there were lots of towns and cities in the country that their figures would have been subsumed within larger ICS organisations. However, notwithstanding that, we do have lower numbers than we would all probably like to see. And I'm really pleased that Portsmouth City Council is arranging a GP summit on the 4th of August, bringing various stakeholders together to discuss this further. So I think that would be really useful. The report itself highlights various measures that are being taken to support the aim of getting more GPs into the city, and also more general efforts to support practice resilience within Portsmouth. I know the Council wishes to explore the possibility of employing GPs directly or perhaps through the Portsmouth Primary Care Alliance. And I think from a contractual and a practical perspective, the latter would probably be the most viable option. And to that end, we have been working with the Alliance over the last few months on developing a proposal which is mentioned in the paper. And we hope to have a bit more news on that at the summit on the 4th of August. So I hope the paper helps set out some of the context and background to GP provision in Portsmouth and highlight some of the plans that are in place or in development. Very happy to take any questions, and we'll try and answer them now, or very happy to take them away and come back to you before the end of the week.
Many thanks, Steve, for that overview. Members, are there any questions or comments? Matthew.
Thanks very much, Susie, and thanks very much, Steve, for presenting the report, and thanks to Joe in her absence for putting this together. This is an important report,